The prostate gland, roughly the size of a walnut, is situated just below the bladder in men. It plays a crucial role in semen production. However, with age, the prostate may enlarge, leading to a condition known as benign prostatic hyperplasia (BPH). While BPH is benign and non-cancerous, it can cause troublesome symptoms. Understanding the risk factors, signs, and symptoms of BPH is essential for timely diagnosis and management. Understanding benign prostatic hyperplasia (BPH), benign prostatic hyperplasia (BPH), is characterized by the enlargement of the prostate gland, leading to urinary difficulties. It's important to note that BPH is distinct from prostate cancer, although they can coexist. Risk factors for BPH. Several factors increase the risk of developing BPH. Age. Men over 50 are at a higher risk, as BPH prevalence rises with age. Family history. Having a father with BPH increases the likelihood of developing the condition. Lifestyle factors. Being overweight, sedentary lifestyle, and erectile dysfunction are associated with a higher risk of BPH. Signs and symptoms of. Recognizing signs and symptoms of BPH is crucial for early intervention. Common symptoms include urinofrequency and the need to urinate frequently, especially at night, due to pressure on the urethra from the enlarged prostate. Urgency, sudden and strong urges to urinate, even when the bladder is not full, leading to potential incontinence. Weak urine stream, difficulty in initiating and maintaining a steady urine flow, which can result in incomplete bladder emptying. Interrupted urine flow starting and stopping during urination, indicating partial urethral obstruction. Inability to empty bladder completely, difficulty in completely emptying the bladder, leading to post-void dribbling. Pain or burning sensation, discomfort during urination, often accompanied by blood in the urine. Blood in urine, hematuria, ranging from light pink to deep red, may indicate irritation and inflammation in the urinary tract. Sexual dysfunction, BPH can also lead to erectile dysfunction and other sexual problems. Diagnostic evaluation. If experiencing symptoms suggestive of BPH, it's essential to consult a healthcare professional for a thorough evaluation. Diagnostic tests may include a digital rectal examination, prostate-specific antigen, PSA test, urinalysis, and imaging studies like ultrasound or MRI. Management of. Treatment options for BPH aim to relieve symptoms and improve quality of life. Depending on the severity of symptoms and individual preferences, management strategies may include surgical intervention. In severe cases, or when other treatments fail, surgical procedures like transurethral incision of the prostate tube or open prostatectomy may be necessary to remove excess prostate tissue. Lifestyle modifications.